I just wanted to say at the beginning of my little bit, and I won't go on for very long, echoing really what Matt's already said about it's not just about the legislation. Obviously, we're at the moment in the thick of the legislative process around the Children and Families Bill, but that's only going to really put in place the framework, and a very broad framework, as to how we improve services for children with special educational needs. And there'll be lots of things that aren't in the legislation. And that doesn't mean they're not going to happen. It doesn't mean there won't be levers and incentives we can use to get them to happen. But I'll just flag that up, because there will be, I think, increasing pressure from many partners and stakeholders, as we used to call them, to try and make changes to the bill. And you'll see these debated as the bill goes through Parliament. But it's not the be-all and end-all that something goes in the bill. And as I say, it's just a statutory framework for the improvement of services. And I would emphasise that second point. It is about doing what we can to improve the way in which services are assessed, planned, commissioned. It doesn't mean we're going to end up with perfection. And I'm not saying that simply to kind of manage people's expectations, but I just want people to be understanding of the position we're in terms of public sector services. And we won't have the answer to every problem in relation to the new system we want to try and put in place. There will be a lot of answers, and we will, I think, deliver real improvement for this group of children. And where we don't have all the answers or solutions, I think it gives us a very good basis for finding answers locally and having those discussions locally in a more integrated way to make the more difficult decisions. So I'll just flag those two opening thoughts up. A little slide here, just setting out the new structure in the NHS. Now, many of you, I'm sure, will be familiar with the changes that are happening in the NHS. And this is very timely for us to meet now, because the major change will be happening just a couple of weeks' time. On the 1st of April, as you'll probably know, the NHS Commissioning Board will take responsibility for oversight of the NHS. And it's an independent board, obviously. It is accountable to ministers and to Parliament in the usual ways, but it has a great deal of autonomy and independence as to how it manages the NHS. And PCTs will be replaced by clinical commissioning groups, as I'm sure you know, locally. And most of those have already been authorised, and it's been agreed they will take responsibility for commissioning budgets. There's still a number that remain to be authorised, but I think the idea is all of them will be online from the 1st of April to assume responsibility for commissioning health services locally. And they'll commission most health services, I'm sure you know. The board will have some responsibility for certain things like primary care services, GP services, for example, which it wouldn't really be suitable for a clinical commissioning group to commission because of a conflict of interest. CCGs obviously are comprised of local GPs. And the board also has responsibility for specific groups of patients as well, such as armed forces personnel and their families, and people in custody, those sorts of groups. But by and large, it will be, of course, the CCGs that do most of the commissioning of NHS services. As I said, CCGs are comprised of local GPs, and this government feels very strongly that it's essential that local clinicians are the people making the decisions about what care people need, and the CCGs make that happen. And obviously they will work with other clinicians locally, other medical professionals, and obviously patients and their families in doing that. It's often been said that GPs are not always very well cited on issues relating to disability. I see people nodding around the room. I think a lot of GPs, a lot of GP leaders will probably agree with that. The CCGs, the clinical commissioning groups, the principle behind them is it's not that GPs know best and that they are tremendously well informed about every condition they might have to be commissioning services for. It's more about making use of that clinical mindset as the basis for better informed local commissioning. So we don't go into this new system thinking that GPs know everything about children with special educational needs in the same way they wouldn't know everything about, for example, cancer services. But it's the basis we're going to build on, and one of the things we want to do as a department is see what we can do to help skill up the GP workforce as well as the wider workforce. And one of the things we're looking at the moment, for example, is a kind of an e-learning platform that can be used not just for medical professionals, but anybody who works with children with special educational needs or disabilities, complex conditions. And we'll use that as a basis for really developing the expertise and the awareness of the workforce. So just to flag that up, we're not thinking that GP is the answer to everything, but we think they're the best people to provide local leadership for commissioning to meet the needs of patients in a more effective way. Worth flagging up, the commissioning board has published planning guidance already for the coming year. And I've mentioned that if you want to find out more about the detailed logistics of how the NHS commissioning is going to work in the future, the commissioning board website is quite a good resource, and there's lots of easy to follow information there, as well as some more complicated stuff around allocations and what have you. But it's worth having a look if you want to have a look. It also has a full list of all the CCGs as constituted. What I did want to flag up in particular in relation to the board is the mandate. And I would imagine that many of you have already seen this. The mandate is the way in which the government talks to the NHS. It sets the priorities and the objectives for the commissioning board, and the commissioning board in turn will use that mandate as its guide to what it expects from the clinical commissioning groups. And so in a sense it's very similar to the old operating framework. And this is the only way in which the government is able to talk to the NHS. It can't in theory provide any other forms of direction or guidance to what the board has to make sure the NHS delivers. So it's a very important document, and as you may well have seen, there's already a clear statement in there. There's a strong expectation of improvement for services with children with special educational needs, and in particular the mandate very helpfully highlights about being able to access the services identified in the plan. So that would include any planning that happens now, but also, of course, includes education, health and care plans, which will be introduced under the new system that the Children and Families Bill is going to introduce. That's a very important message to the NHS, and the board will be held to account for this by the government, and in turn we'd expect the board to be holding clinical commissioning groups to account for this. I mentioned the mandate as the main, one of the main levers. There'll also be an outcomes framework, and obviously we're looking at some of the outcomes in that in relation to children, and you'll probably be familiar with the broader piece of work that the Children and Young People's Health Outcomes Forum is doing about developing some usable data sets and indicators that we can use to show us that there is an improvement happening for services, and obviously there's a subgroup of the forum that focuses on special educational needs and disability that's making that a priority. I want to also emphasise the various statutory duties that clinical commissioning groups have. And again, this is something that the commissioning board will hold those CCGs to account for in their annual performance assessment. And these include the sorts of things you'd like to see around acting consistently with that mandate, it's that mandate duty I just mentioned around special educational needs, working to integrate services, and again, the Children and Families Bill takes that a step further, working with local authorities, working with the health and wellbeing boards, making sure that the work of the CCG, the commissioning plans, fully reflect the locally agreed health and wellbeing strategy and the priorities, the needs to be identified in the joint strategic needs assessment locally. And currently they're putting the finishing touches to the formal guidance that goes out for health and wellbeing boards about what the joint strategic needs assessments and the strategies ought to cover. And that will include references to children with special educational needs. And that slide just emphasises the importance of the working with the Health and Wellbeing Board. That's one of the things we want to centrally see to make sure there is good working between the CCG and the Health and Wellbeing Board, particularly in relation to children, of course, in this group. And that's something we want to really emphasise going forward with CCGs. I will talk very briefly about the commissioning duty, because this is quite a biggie. You'll have seen that we announced an intention to introduce a duty on CCGs in the Children and Families Bill in relation to special educational needs. It's now been tabled, which means the actual form of words we'll use in the bill has now been published, and that will be debated probably this week in committee. And one of the things about legislation is it's often quite opaque, quite dense and hard to follow. The Children and Families Bill, certainly in relation to special educational needs, is not. It's actually very clear, I think, if you have a look at the provisions that have been drafted in relation to what the joint commissioning arrangements will cover for children with special educational needs, the must-dos, it's very clearly set out. And similarly, we want this duty to be equally clear. And the idea is the duty will mirror the duty that is on local authorities currently to make sure that children can access the educational services which are in their plan. And what the duty will say is, if you've got a health need identified in the plan, a health element, then the CCG has to make sure that they secure that for the child as well. So it effectively mirrors the duty that's currently there. And this is a very significant step, as I'm sure many of you will be aware. It's in fact unprecedented in the NHS, and I think it's a very good indication of how seriously the government takes getting this right and making sure there is this real improvement. It doesn't undercut the ability of a CCG to determine themselves what they want to commission by way of health services locally. It's not saying to them, you have to commission care for children with special educational needs, but that in itself is already covered because they have to commission care that meets the reasonable needs of their patients, and that would include children. So it's quite a significant thing in legislative terms, and we think a significant thing in the way in which CCGs will have to focus on these plans and make sure they are commissioning the care locally to deliver the health bit that's in the plans. So it's a very important point, and it might well be subject to quite a lot of scrutiny in the press in the coming weeks and months. It's not necessarily what everybody would like in terms of how far it goes, but it is a very significant step, and I think we're quite pleased that we're able to make that commitment. Obviously, the code does apply to health bodies. They have to have regard to the code of practice, and as Matt says, the code is being tightened up. It's going to be improved so it has specific emphasis on the health side of things and can support the role of CCGs in the education, health and care planning. And the current draft that's out there is literally just a first draft, and it will be much worked upon, hopefully with the involvement of stakeholders like yourself in the coming months. In terms of the Pathfinders, I won't pretend that the Pathfinders have found it easy engaging with health, and that's partly because of the great upheaval that's happening locally with PCTs giving way to CCGs. But now we've got CCGs getting established and tackling their commissioning responsibilities, I think Pathfinders are going to find it much easier to have that dialogue with CCGs locally, and we're going to try and support that and encourage that from the centre as far as we're able. But the Pathfinders that have been working well with health have found it very encouraging and very positive. In terms of the overall work of the Pathfinders from the health side of things, I think it's the engagement with patients, with parents, with families that is the most positive thing to bring from this, because it's very much a paradigm of how we want to see the reformed NHS working more closely with parents and children, with families, with the patient in taking forward commissioning. And I think that's something that the wider NHS will be able to draw on in the coming months. So we're very pleased with that. And obviously, there's various other things in the pipeline that are going to make a big difference in terms of the local patient experience. Personal budgets in particular is a big one. We haven't got time to talk about it now. But obviously, it's going to make a big difference to parents, to families and the patients, to have that control over the money so they can spend it as they want locally and make decisions locally about how they receive the care they need. And that will make a big difference, again, in the context of the reformed NHS. And it's 9 Pathfinder champions now, I realise. I said 9 to 15, but 9 Pathfinder champions that are going to be working locally about spreading the learning from the Pathfinders, but also have a national role as well in relation to various bits of the Pathfinder agenda.